Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the podcast. This is Aebhric O'Kelly. This week, we are again in Malta. We are on the iCare, the Intensive Care for Austere and Remote Environments. And with me is Splinter, a BSc student who is a participant on the iCare. Splinter, welcome back to the program.
Thank you very much.
So tell us about the week.
Yeah, really awesome so far. We've done 4 scenarios every single day since we've begun. We've had some introductions to getting to know. We're in quite a large group in my experience. I'm used to like the 6 to 8. And now we're 15, 16?
15.
Something like that. So we've had a short introduction. Basically, we went straight into the scenarios and discuss lots of good discussions as well, lots of different backgrounds as well, where I've had a lot of lessons to take home from. The case studies in the morning are really helpful as well. It does show me how much more remote environment thinking I have compared to people who are used to working on the street ambulance. So that is something that I've come to realize, speaking to these people who haven't done such a intensive, who haven't been working such intensely in remote environments. So that's one of my,
What are some of the lessons learned you've gotten this week?
Definitely trust myself. I think that's one of the bigger ones. I've always kind of been a bit iffy on treatment and if I know the right thing. And let me just restart that.
Yep.
Trusting myself, one of the big lessons I've learned. I've always been a bit iffy about my knowledge and if I know the right things and if I can apply them in the right scenarios. I am a bit of a perfectionist, so I would always like to perfectly treat my patients. You know how it is in remote environments. You don't always have the luxury of knowing everything or having everything. So that's when I rely on the things I was taught, the things I was told, the research I've done, as well as my past experiences.
So tell the listener a bit about the people on the course this week.
So we have a wide range of students here. We have a bunch of Germans as well as English. Most of them have offshore experience. So many of them come from offshore installations, as well as wind farms. Many of them are off wind farms as well. I myself am a BSc student. I have some the English boys. They are primarily just 999 ambulance paramedics. We have some in the physicians programs and who just finished medical school. That's kind of the experience we have running around.
So last week you were on the TTEMS. This last weekend you did the APIS, which is the POCUS, the ultrasound, and now you're capping your 2.5 weeks in Malta here. So what are some things that you've learned here on the iCare course?
Skill-based, I think doing central lines in blue time, just having a look at that, talking about that, discussing that, applying POCUS as well in scenarios, but finding the when to do the ultrasound. That's been one of the challenges I've been running into. When would you do a rush? When would you do a EFAST? But that's something I've definitely taken home is to find the right moments to apply one or both of these ultrasound tests. I'm trying to think if I have any other lessons to take home. There definitely are lots of improvisation things I've taken with me as well. Lots of new ways of thinking, lots of interests as well. We did the wound vacs this afternoon, and that kind of got my brain thinking of what other ways could you improvise this other than cling film or the big, what do you call them? The
tegaderms.
The tegaderms. I don't even know the name. That's how remote medic I'm becoming.
You mentioned blue time. What is blue time?
This is one of your terms, Aebhric. Blue time is a free-for-all. In a sense, it's if you want to suture, you can suture. If you want to intubate, you can intubate. If you want to have discussions on new research, you can do that. And if you want to leave, you can leave. It's basically a free time to do the things that you feel like you require practice in or doing, or it's whatever your heart desires.
And what are some of the things that you've done on blue time this week?
I have done some RSIs, just running through the steps, doing the speed bomb, doing the post lives. Getting just the reps in with the intubation itself, just getting that muscle memory down, understanding like how much force, what am I looking for, just really looking at those steps, just practicing suturing, just getting some hands-on time as well, as that's one of the things we've really been hammering is to have the head time put into hands-on time. So that's those are the two things I've really been working on so far. Yeah.
So the iCare is set up. I designed it so there's lots and lots of scenarios. We have 16 scenarios over 5 days, and not including the PFC scenario you guys will have on Friday. But we have 2 scenarios every morning, 2 scenarios every afternoon, and you rotate through those with some clinical skills. So tell us some of the scenarios that you've seen so far.
So the scenarios are really, I like them. I really enjoy just hammering out scenarios one after the other. So how this week is set up is we have 3 stations, 2 scenarios, and then 1 kind of hands-on practical or discussion time. Some of the scenarios we've seen that we have come across are some crush injuries. So we've had 2 scenarios with crush injuries, rhabdo, and sepsis, all kind of bundled into one gnarly mix. We've had malaria, we've had some dengue, we've had diarrheal diseases. Mainly the top 5 in tropical diseases we've seen, as well as traumas, and yeah.
So one of the labs that I ran was how to build an ICU in the middle of a jungle.
Yep.
What did you learn?
Probably becoming aware of how many components come together to actually have a remote ICU, because it isn't just the medicine part, which is a remote ICU. It's the preventative measures as well. It's where are the latrines? What are we doing with food? What are we doing with water procurements? The fact that those things came together really kind of had a eureka moment for me. Be like, oh, it's not just the medicine what we're looking out for. It is the preparations. It is the research. It is everything before the medicine as well as the medicine, and everything after the medicine.
So what are some things that you need to worry about whenever you set up a ICU in the jungle?
As I said, the preventative measures. I want my research down. I want to know what's happening in this environment. I want to know what's happening in the place where I'm going to be staying. I want to get a general idea of the knowledge and the skill set my participants have. I want to inform them about water, the dangers of just drinking unfiltered, unpurified water. And then medicine-wise, just making sure that there's no wee beasties, as you call them, no mosquitoes, no vectors, anything like that can enter my area of treatment, that it is as clean as possible area where my patient will and myself will be, taking the steps we need to take.
So what are some things from this week that you'll take with you as you move on with your paramedic bachelor's program and eventually your paramedic practice?
Ooh, definitely the contacts. Yeah, I've had some good connections within the group. We've had a lot of discussions, a lot of teaching moments as well. For example, me teaching the other or the other teaching me. Definitely the contacts. I'll definitely take the contacts with me and make sure to keep in touch with them.
Good deal. And what's next for you after you finish your 2.5 weeks in Malta? Where are you going?
Ooh, so I still have placements to do. So that's what I'm working really hard on doing and arranging is my year 2 and year 3 placements. I'm just full send all the way.
Are you going to Tanzania again?
Possibly. Yep. I'm looking at some Western-ish medicine alternatives. Currently looking at Norway, possibly. Just kind of pulling strings where I've got some contacts. So hopefully that brings something. And if it doesn't, I'll have to read some more on what the Western CPGs are so that I can implement them properly and appropriately in Tanzania.
Okay. Well, it's been fantastic to have you on these 2.5 weeks. Good luck.
Thank you.
Our next guest is Dr. Csaba Dioszeghy, who is the Dean of the Critical Care Department and recently stepped into the Chief Operating Officer role within the college, which means that, Csaba, you are now running the day-to-day operations of Quorum.
I do indeed.
And welcome back to the program.
Thank you very much, Aebhric. Thank you.
So you and I'm not sure if we've ever talked about how we met in 2014.
Yeah.
So
you want me to tell you?
Actually, I would love to hear your side of it because I have my side of it. But yeah, Csaba, how did we meet?
Well, I've been teaching all around Europe and also in Malta in all sorts of critical care and life support courses. And one of the, I think it was an advanced life support course, ALS course,
ETC.
where, or it was in an ETC, I'm not sure. But you were, I think you came to this course as an observer, and I
Yes.
was probably the course director or the deputy course director or something. And I was just teaching, and you suddenly just came to me actually and asked whether am I interested in critical care? I said, well, I'm quite interested in critical care. And I said, do you like teaching critical care? I said, I do like teaching critical care. And then you asked me, do you like aeromedical staff? I said, well, I do love aeromedical staff. And then you said, why don't we just join and start teaching together aeromedical critical care and these things. And so that's how it started. And then we've been working together, teaching this HEMS type courses, and then figured out that it would be nice to run it under the auspices of a college. So I think that was the origin of the story.
It was interesting to be in the back of that classroom. And medical students are not the easiest to get engaged anyway. So I saw these lectures coming through, and then someone got up to the front and had the students activated and got the students eager and engaged, where other people weren't quite doing that. And I'm like, well, who is this yoke in the front of the classroom that is actually amazing at what he does? And then so you finished your lecture on whatever it was, and you came back to where the rest of us were standing in the back of the classroom. And I just kind of walked right over, stuck out my hand and said, you need to come to Pretty Bay. And because what you did was magic, Csaba. And I have seen it now for 12 years, again and again and again, you getting in front of students and creating magic.
Wow. Thank you. You know what, I think it's obviously by that time I had about 20 years experience in teaching medical students and well, any sort of healthcare professionals. And my kind of main idea about teaching was always to try to keep things simple. And you know what? There's an interesting parallel in austere and resource limited critical care and this type of teaching, which means that first you need to understand really what's happening, and then you need to be able to reproduce that without much of the whistles and bells. And if I always say that if I can actually explain it in a very simple way, then that means that I really understand it, and then students will really understand it as well. And they love it because, it's not somebody standing out and telling very complex things. They look very clever, but it's not necessarily, transfer the knowledge and understanding. So yeah, I think that's the thing. And this is the nice parallel between resource limited care and the teaching. Just try to keep things simple, but understanding the real background.
You have a knack for it. And I have to be honest, Csaba, it was a very selfish reason to have you join our faculty, because I don't know if you remember, but for the first 4 or 5 courses, 5-day courses you were running, I was in the back of the classroom listening to you again and again and again, frantically writing down. And I mean, this is how I learn. I'm a knuckle dragger, so I need to hear things 2 or 3 times before it finally gets through my skull. And you, not only do you have a way of describing things that are easy for a knuckle dragger to get, but just having you teach the same class again and again and again. And because I didn't know anything about critical care, and listening to you over the years, I'm getting to the point where I think I have a good understanding of it. And then we put the master's degree together, and that was a whole nother our kettle of fish.
It was, wasn't it?
So yeah, we have next episode we'll do a deep dive into the Masters of Critical Care, the Masters of Austere Critical Care. But Csaba, I wanted to talk to you about the classroom. So we started with a 5-day introduction to critical care, or aeromedical critical care, which ended with John Clark coming from America to give the IBSc board certification critical care paramedic exam. And that's how John got involved with us. So the 3 of us have been in the back of the classroom for 12 years. coming up with crazy schemes and ideas.
Yeah, and that essentially culminated in the creation of a master's in Austere critical care program, which has then been obviously accredited by the MFHEA, so the Maltese Higher Education Authority, getting a EU and essentially a worldwide accreditation, which is a great thing. Actually, one of the greatest achievements of almost then I've done. You know, I didn't do it. We did it together, but that's a great achievement. And so this master's program, I think it's pretty unique because we're teaching critical care with very limited resources. And something which is interesting, I've been obviously working in critical care for quite a few decades, and we have all the fantastic equipment and we have all the guidelines and all the protocols. But when I went around to teach these things, even in Europe, I do find people who come to the courses and they say that's all brilliant, but we just don't have the equipment. And it turns out that guidelines not always really consider that the majority of the world, does not have all these equipment which the Western Hemisphere and the this first world countries can provide in their healthcare. So what we try to teach is how to use the understanding of critical care principles, how to use that without all the bells and whistles. And I think that's extremely exciting, but also extremely useful for saving hundreds and thousands and probably millions of lives a year.
It's interesting that we got to the point where we are in 2014, we're running a 5-day Aeromedical transport course for the board certification exam. And even then, you were still putting in some austere concepts. And you and I would chat in between each course we were running, and we kept seeing that there was a need for bringing in the resource limited, the austere side of critical care, even though we were running that, from 2014 all the way up to 2020, I think, is when we got our master's degree. So This was built on a classroom concept and the realization that we needed more, that our students were asking for more, and we needed to focus on a very niche part of critical care, which no one does. There is no other program out there that is doing what we're doing.
Yeah, exactly. And I feel it. All our students, I think there's a gap. So people either know very well how critical care works, but they need to actually then use all the complex hemodynamic monitoring and fancy ventilators and everything, and then they understand the concepts.
So Csaba, we have the iCare course, which is the 5-day course for the master's program. That's the hands-on. And we do that. We start out with the first 4 scenarios is mainstream critical care concepts. And then we build on to them to the point where towards the end of the week, we're dealing with a malarious patient who has cerebral malaria, can no longer swallow, and you have this casualty for extended periods of time. So we build on the basics, but we are definitely throwing a lot of difficulty at them.
Yes. So this was always our kind of approach to the problem, is that learn the basics first, understand the physiology behind it, and then start using your understanding on the clinical scenario. Use surrogate measures because you don't have all the very fancy monitoring system probably. So use surrogate measures, understand what they mean, and apply the principles. And I think the other very important aspect of this 1-week course is actually the teamwork. So people are working as a team. So we try to teach not only the clinical principles and the technical skills, but also the non-technical skills, how to work together, how to put together what we have and get the best out of it.
It's always interesting when I see the iCare course because we have docs, paramedics, and nurses coming together. And you're right, it's a teamwork, isn't it? That it's a crew resource management of a group of, we try to have 4 or 5 per team, and we give them a very difficult, convoluted case for prolonged periods where they have to work as a team to work through this problem set that we give them. And it's the teamwork, isn't it, that they learn?
Absolutely. I think it's especially in resource limited environment, but even, in high resource environment, but in resource limited environment, good crew resource management is absolutely essential and can help you immensely. So this is the other thing we are practicing there. And when I give feedback after a scenario, I always take significant amount of time to talk about the non-technical skills I have witnessed. And I can see actually people's faces, how they realize that things can be done differently or better, or what they have done, because they are not particularly prepared for this type of interaction or this type of feedback. Everybody's concentrating only on the clinical bits, on the technical skills, drug doses and things. And when we start talking about, okay, so how was the communication? How was your situational awareness? How was your resource allocation? And wow, and they learn, and they learn a lot, and they improve by the end of the week immensely.
So I'm looking at the new curriculum of the new master's program, and you completely renamed the 5-day course. It's now Crew Resource Management in Austere Critical Care.
That's one of my passion again. So this, I'm very seriously thinking that crew resource management and teamwork is essential, and it contributes a lot. And understanding and applying that will improve your safety, but also your efficiency as well. And this is, that you really can only learn it when you are there, when you are working in a team. So I decided to use this 1-week course when we are together and we are actually running simulations. That should be one of the main objectives of the course. But of course, we keep on still practicing skills, technical skills. We continue discussing cases. So it's not purely non-technical teamwork, but it is going to be one of the emphasized points for the course.
So the iCare course, as it is now, won't change that much, but we have just renamed the master's module and calling it now Crew Resource Management in Austere Critical Care.
Absolutely. So it doesn't need to change because we're already doing this. Renaming was just pointing out that this is extremely important. And I'd like, because it's going to be a non-mandatory part of the MSc curriculum. So it's an elective from August, which means that, people might think that, well, I don't want to travel. So I wanted to put something which they will not learn anywhere else. You can't really learn this online. You can't really learn this from lectures or even webinars. What you can really do is to practice it. And the only way to practice it is in simulations here. So that is why I put this as a title. For our faculty also, it's a reminder that needs to be a part of the feedback and part of the practices.
Well, I'm looking forward to seeing how iCare changes starting in October or August. Well, the course is in October, but the new masters we hope to launch in August. So the 5-day course has evolved tremendously since when you and I created this in 2014. And now it's come to the point where we're seeing that crew resource management really is the glue that holds everything together. I mean, we're not giving these doctors, medics, and paramedics extra training that's going to enhance them. I mean, yes, we give them some cool guy stuff that we do, but they bring their own medical background, and it's the crucible of this 5-day course. Well, the challenges we give them, and they can only be successful as a team. And I think they cop onto this by the afternoon of Monday, that this is a team sport.
Absolutely. So, yeah, I think iCare is a good course. The feedback from students is always really positive. They do learn a lot. They do networking together. Working together with like-minded people is always good. but also good that they are working with people who they never seen before. And they started to form a team, which is essentially dropped into the middle of a very complex scenario, and they solve it. And they solve it better and better as the week is going. And they can take this away. They can take this home, and they can start working with any team. And it is also good, not only in critical care and not only in NASA critical care, wherever you go, even if you go back to your ITU or your ambulance service or wherever, you're going to use this, because these are principles of how to work together in a best possible way, how to use our resources, how to keep situational awareness, how to communicate, how to allocate tasks, making sure that they are, the safest and most efficient team needed. So it's definitely a good, and they learn a lot of things in iCare, which is not very. I learned a lot in iCare when I was working with you, and looking at all the tropical things and malaria screens and microscopes. That we do lots of ultrasound. They can practice ultrasound, so there are technical skills as well. So do not misunderstand the title of the course. The title is Crew Resource Management and Teamwork and After Critical Care. But there are important technical skills as well, which we can practice and learn there. So although it's not a mandatory part of the masters, I very, very strongly recommend it to everybody.
And it's going to continue to be a CPD course. So you can take the iCare as a non-matriculated student. So we do have people coming from all over the world to take this, even though they're not part of a degree program.
Yeah, it's like the ATLS or ETC course, or just an ACLS or ALS course. They are part of. They can be a standalone course. It's still extremely useful, but usually part of specialist training, for example. So if I want to be a specialist of emergency medicine, I must complete ATLS and EPLS and ACLS and all the things. I must complete those courses. But anybody can also do that as a standalone course. So it's useful. Yeah. And it's a fun. It's a fun course, isn't it?
It is. It is one of my favorite.
Yeah. Smile on the people's faces.
Yeah. And I enjoy the getting them excited about austere critical care towards the end of the week, and when we throw them in the long prolonged field care exercise, and just see them come together and address these hard cases we're hitting them with in dark environments with loud noises and difficulties, and it's fantastic to see them grow over the week.
Yeah.
Well, Csaba, thanks for having a chat about the iCare and the redesign of the iCare into the new crew resource management. And we are going to see you again this next week. We have another podcast with you next week, and we are going to do a deep dive into the new Masters of Austere Critical Care. So, Csaba, thanks for joining us on our podcast this week.
Thank you. And I'm looking forward to the next week, because the new Masters is going to be a game changer.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credits, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.